immunology deals with the protection against invading infectious organisms and the development of cancer cells. Our own work focuses on small molecules called cytokines that the immune system cells use to talk to one another. They're analogous to enzymes. And within that, we study two of these extensively, called interleukin-2 and interleukin-15. When they function well, we're protected from infection. But when they're abnormal, we may have leukemia of T cells or autoimmunity. So in the late 1970s and early 1980s, we discovered the first of the receptors for a cytokine called IL-2 alpha. This receptor that the antibody saw expressed in leukemia of T cells, expressed in autoimmune diseases, expressed in T cells rejecting grafts like kidney grafts. We reasoned that an antibody, if we could make it to this, would be very valuable therapeutically. And so we made such an antibody. Most frequently, we have armed it with a radioisotope that causes a radiation. And we use this antibody as a magic bullet so that it goes through the body and sticks into areas where this receptor is expressed. When they get there, they irradiate the tumor. The biggest triumph, I believe, was in multiple sclerosis. Here, treatment with this antibody, daclizumab, Zenapex, one can reduce the number of new lesions by 72 to 78% with no toxicity. This was validated by studies in over 200 patients. Most recently, we have completed the production of IL-15 here at the NIH in a way that it can be used in patients. And we have received approval from the FDA and from the Cancer Institute, and are just starting, seeing the first patients with metastatic malignant melanoma and metastatic renal cell cancer. What we hope is to make and continue to make new insights about how the immune system is controlled and disorders in this regulation that underlie immunodeficiency diseases, autoimmunity, and leukemia.